Hi, my name is Sarah Buckley, and for the genetic and fetal assessment testing, I chose to do amniocentesis. So what is an amniocentesis? It is a prenatal diagnostic procedure that looks at fetal chromosomes, but can also look at intra-amniotic infection, intrauterine viral infections, and also can assess fetal lung maturity. An amniocentesis can also determine paternity, and it also is being used in clinical research for stem cells. There's limited information on this due to ethical concerns. An amniocentesis examines the amniotic fluid within the amniotic sac. Those cells can be taken from the amniotic fluid and can be studied to determine genetic anomalies within the fetus. The most common ones seen are Down syndrome, cystic fibrosis, and spina bifida. An amniocentesis used to be used in 1877 as an amniotic tap. When a mother had too much fluid in her abdomen, they would use it to give her comfort and remove some of the additional fluid. In 1930, they started using amniocentesis in order to visualize the fetus and placenta. During the procedure, they would palpate the mother's abdomen to determine the insertion site and went in blindly. They would insert dye in order to see the structures. In 1949, amniocentesis were collecting cells and found bar bodies, which are used to determine the gender of a baby. In 1966, Steele and Roybregg cultured cells in order to karyotype chromosome anomalies. In 1972, the ultrasound was introduced, and we could use ultrasound guidance in order to determine that we were inserting the needle into the correct spot. Amniocentesis has an 82% sensitivity and a 99% specificity when looking at bacteria in amniotic fluid. It's 99% accurate in determining the father of the baby, and there's a 98 to 99% accuracy on determining genetic anomalies. While an amniocentesis can determine that there is a genetic or chromosomal issue with the fetus, it cannot determine the severity of, say, Down syndrome in the baby. Amniocentesis used to be used on patients who had advanced maternal age, but now it has become an essential testing during genetic screening for infections and fetal lung maturity. You would perform an amniocentesis if a fetal ultrasound suggested that the fetus might be compromised due to an infection reason or other genetic reasons. While some tests can confirm that there is a genetic issue, the amniocentesis can give a specific diagnosis. Amniocenteses are usually performed between 15 and 20 weeks of gestation. They are indicated when there was a previous pregnancy where there was a chromosomal issue or if there's a family history of any genetic issues. When a woman is pregnant with multiple babies, so twins, triplets, or more, those babies are more likely to have a chromosomal abnormality, so all mothers carrying multiples should have an amniocentesis. Advanced maternal aged women are more likely to carry multiple children at once, so they should definitely have an amniocentesis. An amniocentesis can also be done in the third trimester, so between weeks 32 and 39. It can be used to assess fetal lung maturity and also can be a treatment for polyhydramnios. If delivery is imminent, a amniocentesis should not be done. One would think you would want to have an amniocentesis in order to determine the fetus's lungs, but you would not do so. This could cause preterm labor and preterm delivery. Maternal and fetal risks, if they're present, then you should deliver regardless of the state of the infant's lungs. The American College of Obstetrics and Gynecology do not recommend doing an amniocentesis to assess for fetal lung maturity. The lungs are the last organ to mature in a baby, so you would want to wait as late as possible to deliver. All benefits and risks should be weighed and discussed with the provider to make the best decision for both mother and baby. So prior to an amniocentesis, the provider should obtain consent. All risks and benefits, what to expect during the test, both during and after, and any complications should be discussed with the woman and her partner prior to performing the procedure. The amniocentesis takes about 45 minutes, and the sample collection only takes 5 minutes. A woman can expect for her abdomen to be cleaned with an iodine-containing cleanser, and then with ultrasound guidance, a 20 or 22 gauge needle will be inserted to the abdomen and into the amniotic sac. Usually no anesthetic is used during the procedure, and the pain is described to mothers as a mild discomfort. With the needle, about 20 to 30 mLs of amniotic fluid will be removed. That fluid is then put into a centrifuge and cytogenetic analysis will be performed. Results can vary, it can take up to days or even up to 4 weeks for any test results to come back. So what are the advantages and disadvantages of an amniocentesis? Looking at this slide, it looks like there's a lot more disadvantages and complications of an amniocentesis, but the complications are very, very small. With this, the advantages are that there's a direct analysis of the amniotic fluid, so it really is able to determine if there's a neural tube defect or any other anomalies in the fetus. It also avoids confined placental mosaicism, which is seen in chorionic villus sampling. This is when cells from the placenta and from the fetus mix together. Some disadvantages are miscarriage. So this occurs in about 1 in 4 times that amniocentesis are done. Needle injury to the fetus, but now with ultrasound guidance, it is less likely to occur. So this occurs in the second trimester if you have an amniocentesis done. So if there is a genetic problem with the infant that the infant won't live, parents might want to terminate the pregnancy. So termination during this time imposes an increased risk for the mother. You can also have infection of the amniotic sac, which occurs in less than 1 in 1,000 procedures. There might be transient amniotic fluid leakage. You can see that's a very small percentage as well. A mother might have light vaginal bleeding and spotting. Pregnancy loss rates are 1 in 300 to 1 in 900 pregnancies. And there's also the risk of women with bloodborne illnesses can transmit things like HIV and the Hep B virus or hepatitis C when they inject the needle into the amniotic sac. There also is the issue of Rh sensitization. So if a negative mother has a positive blood type baby, there's the risk of sensitization occurring. So once you have an amniocentesis, they're looking for certain proteins and other labs within the amniotic fluid. So alpha-fetoprotein is a screening for neural tube defects. So if that's within the fluid, that'll indicate that there's an anomaly with the infant. You're also able to analyze fetal DNA. So you're looking at the chromosomes, which could indicate any genetic, neurological, or chromosomal fetal abnormalities. When you use a amniocentesis looking at fetal lung maturity, there are certain lab values that one will be looking at. So the LS ratio, if it's less than 2 to 1, then the infant is more likely to suffer from respiratory distress syndrome. If PG is present in the amniotic fluid, that shows that a fetus's lungs are more mature. The next test is the fluorescence polarization. It shows the surfactant levels in amniotic fluid. And this test is good because results come back in less than an hour. The foam stability index, or the shake test, you want a value 47 or greater. But the problem with this is that there's frequent false negative results. And you're also looking for lamellar body counts, and you want more than 32,000. So what would you do with any results? So depending on genetic results, it's ultimately the parent's decision. If the fetus is going to have a genetic issue where they won't sustain life, parents might want to think about termination of the pregnancy. If results come back and say the parents are going to have a baby with Down syndrome, you would look to help them supportively. So looking for community resources, making sure they have good family support, and making sure that the parents are going to understand that major lifestyle changes might have to happen in their family. You would continue with normal maternal and fetal assessments and appointments according to the guidelines if the parents wish to continue with pregnancy. And also you want to anticipate what the neonate might need post-delivery. When using an amniocentesis for fetal lung maturity, one might administer antenatal corticosteroids to decrease the risk of respiratory distress syndrome in the neonate. So medications like betamethasone or dexamethasone are administered to the mother in order to mature the fetus's lungs. And if an Rh sensitization is found, you might want to consider fetal blood transfusion post-delivery if needed. So prior to the procedure, you would want to let a mother know that if she's having an amniocentesis before 20 weeks, she should have a full bladder during the procedure. And after 20 weeks, she would want to have an empty bladder. You should let the mother know that she might experience cramping, irritation at the puncture site, and any leakage of fluid. After the procedure, the mother should look out for fever and inflammation at the insertion site, if she has uterine cramping that's lasting an extensive amount of time, if she has any excessive bleeding or leaking from the puncture site or even vaginally, and if there's a lack of fetal movement, she should call her provider. Genetic counseling and interdisciplinary teams are going to be utilized during an amniocentesis in order to interpret results correctly. And if the genetic results come back, you need to discuss with parents termination if the baby isn't going to sustain life, family planning for a child with special needs, because there's going to be major lifestyle changes, and any support groups and resources that might be available to them. So on this slide, I found 3 scholarly articles that are in support of using amniocentesis. So the first one was looking at fetal lung maturity. Fetal lung maturity testing can be beneficial during pregnancies if they were poorly dated or were dated incorrectly. So if you use an amniocentesis at a specific time, it can lead to mothers receiving antenatal corticosteroids, which would lead to less of a chance of the baby developing respiratory distress syndrome. Women between the weeks of 24 and 33 might be receiving steroids if they're going to deliver within the next 7 days. Women with premature rupture of membranes before 32 weeks would also have steroids administered. And women between 34 and 36 weeks also at risk for preterm delivery within the next 7 days, and who haven't had steroids previously would also be administered betamethasone. In another study, amniocenteses were used to determine if maternal infections crossed over to the fetus. By using this type of test, it enabled providers to provide therapeutic, supportive, and medical management for both the mother and the fetus if infection was present. This also helps decrease stress in parents because often parents might feel guilty that they have an infection and it's crossing over to the fetus. And lastly, there was another article that showed having the knowledge of a baby having Down syndrome prior to delivery can help parents cope and prepare for life with a special needs child. So having an amniocentesis done and giving positive results for Down syndrome, parents were able to prepare, enter community groups to discuss bonding, attachment, relationships, and health promotion for parents and the future child. These are my references. I realize that the formatting isn't great, but I will fix that prior to putting my slides up. And here are the references for any pictures that were in the slideshow. I look forward to any questions that you may have for me. Thank you.